Great. So welcome again. This is our webinar featuring families sharing our findings from our child care survey that was released in the fall of 2023. Today, we're going to start with a little bit of background about who CIFD is. We are relatively, well, the department's also relatively new, but particularly our team, the Child Care Policy and Equity Unit, is particularly new. We're about a year old, and so I know that many are still becoming familiar with us. So we'll give you a little bit of background about who we are, and then we're going to, I'm going to turn it over to my colleague Kisu, who's going to walk us through a little bit of background on the survey itself and the demographics of those who responded. Then we'll walk through some of our findings that we got. There's a lot of data here. We selected a few to share with you, but we're happy to continue the conversation at a different time if you're interested. And then, of course, we'll save some time for you all to provide your reflections, your feedback, your questions at the end. Community Investment for Families Department, CIFD, the vision is to break the cycle of generational poverty by building community wealth. And we do this with a variety of different programs that meet families when they're in crisis, help them build stability, and then ultimately allow them to thrive. And so the Child Care Policy and Equity Unit is doing just that through providing increased access to childcare, particularly focused on children 0 to 3, because we know that infrastructure could use some additional support, particularly with the rollout of kindergarten. And we're seeing a lot of staff and students go over to the school districts who want to make sure the community caregivers are still getting support. And we do our work in 3 ways. We coordinate and collaborate with city departments and other ECE leaders at the local, county, and state levels to really deep dive into the existing systems and to find ways to strengthen and improve them. We also are focused on streamlining information. We've created a centralized hub on our website of information that we're continuously updating and developing so that there can be a one-stop shop that leads to all of the different amazing work that's happening in the city, county, and state. And then lastly, we advocate. We advocate on behalf of providers as well as families to get improvements to the existing systems, again, at the local, state, and county levels. And so this is our team. My name is Rachel Bocarsley. I am the program manager for our team. I'm joined here today by my colleagues, Hisu Kim, and intern Zafania Hartoho. We all put a lot of heart into this work. And so really just a shout out to the full team who's really been dedicated to this work, and we're excited to share it with you. So I'm going to go ahead and kick it over to my colleague Kisu, who is going to walk us through the overview of the survey and demographics of those who participated.
Hi, good morning, everyone. Thank you, Rachel. And I think we can go to the next slide here. So the goal of our survey was to learn about Angeleno families' childcare priorities and their unmet needs so that we could use this information to guide our work as a childcare team, our initiatives and the resources that we would develop, and of course also to share out the results with the community. So the survey ran for 8 weeks, about 8 weeks in 2023 from August to October. And we basically asked Angeleno families who had young children to report on their experiences, finding, and paying for care, and also what they wanted to see the city work on. And you can see the questions to the right. We asked 5 main questions about childcare experiences, what types of care they were using and how they were paying for that care, where they found their childcare information, and also how the city could best support them with the care. And as part of our department's commitment to language access, the survey was made available in 8 languages that we consider priority languages in the city of Los Angeles. You can see them in the picture, but I'll just read them out. The languages were English, Spanish, Chinese, both simplified and traditional, Farsi Persian, Korean, Armenian, and Tagalog Filipino. Next slide, please, Rachel. So we did a combination of outreach, online, social media, and also in person. And we conducted this outreach at 3 different points in the survey's open period, basically to encourage many of the folks here on this call to help share out the survey and promote the survey, to the unique populations that we all serve. This included outreach to our fellow city entities, community-based organizations, and also we did a specific promotional push for CBOs who serve diverse language populations, since that was one of our goals. And finally, to early care and education networks. Next slide, please. So we did ask our survey respondents to report on their zip code. And in our analysis, we found that we received over 400 responses in total by the survey's close date. 399 were from the city of Los Angeles. And for the purposes of our survey, since we are focused on Angeleno respondents, we did choose to exclude the 25 participants who we found to have been reporting from outside Los Angeles City. So our results are looking specifically at the 399 participants from Los Angeles City. Next slide, please. So these next few slides, I'm just going to talk through what we learned in terms of respondent demographics, so the languages they spoke, where they were coming from, and also their childcare desert status. This chart shows that our survey participants were mainly English and Spanish speakers. You can see that we received a little over 260 English responses, 130 responses in Spanish, and you can see that although we did do targeted outreach to galvanize participation in other languages, the survey received only 5 responses in other languages other than Spanish and English, I should say, and those were in Chinese and also in Korean. We do want to note that this is the first time that CIFD has translated a survey into 8 languages. We were very intentional about reaching out to CBOs, community-based organizations who were working with specific language populations. And although we didn't get a high number of responses from language communities other than English and Spanish, we just want to make sure that we underscore the fact that the numbers that we reached in our survey in these language categories certainly doesn't reflect the interest or the need of these communities. We know that people outside of English and Spanish speakers also really need childcare and need more supports in childcare. So we just want to recognize that. And we understand that there are a lot of factors that may have affected our outreach and engagement that we'll be continuing to consider. So going forward, our department, we are actively discussing ways that we can improve the response rate for efforts like these to continue to increase engagement and the diversity of our reach with similar efforts. And I just want to take a moment and recognize and thank the many CBO partners, many of whom are probably present on this call today, who helped us push out this survey to the community. So thank you for your efforts and for your partnership. Next slide, please. Okay, so we also looked at the council districts that our respondents were reporting from. So we got respondents from most of the districts, as you can see, and we saw the most representation from council districts 1, 5, and 8. But we also do want to note that there is an uneven distribution from council districts. There are some council districts where we did not see very many responses, so we're conscious of the limitations when we're attempting sub-analyses that are specific to each district. Next slide, please. So let's talk about where our respondents came from in terms of childcare deserts. Just to quickly define it, childcare deserts are basically areas of childcare scarcity. So we define them as census tracts that have more than 3 times as many children as there are licensed childcare slots or seats for them. These 2 maps that you see side by side, they show just how closely childcare deserts often correlate with poverty. You can see that the hotspots of low childcare supply, those are kind of the more orange spots, correlate with those darker red spots on the chart to the right. So in other words, low-income areas, they're often marked by areas of worse childcare scarcity. So in our analysis, we just want to note for the folks on the call today that we're aware of this close intersection, and because of that, we did consider if we saw survey respondents who were in childcare deserts, we made the assumption that they're also in areas that have higher rates of poverty, and that's an assumption that we did carry through our analysis. Next slide, please. Okay, so the majority of our respondents live in childcare deserts. No surprises there. You can see that our definition of deserts is in the chart to the right. The third column on that chart there, I just want to explain, we titled it slots as a percentage of childcare population. That's just a calculation of childcare slots available per the number of children under the age of 6. and what we're calling status 1 and 2 are what we're defining as childcare deserts. So if you look at the chart to the left, you can see that ultimately when we take status 1 and status 2 together, we see that 61% of respondents were found to be living in these childcare deserts and are therefore living in these areas of severe childcare scarcity. Next slide, please. Spanish respondents were more likely to live in childcare deserts. So on these two pie charts, they're representing the proportion of respondents living in childcare deserts, and the colored slices are showing you how many folks are living in the desert. So the red slices are for status 1, the orange slices are for status 2, which were slightly less severe, but still what we consider to be childcare deserts. And you can see that versus the English speakers chart on the left, Spanish speakers had a higher incidence of living in childcare deserts. It comes out to be 72% of Spanish respondents versus 55% of English respondents. So it is a big difference there. Next slide, thank you. And before I give it back to Rachel to go through our findings, we just wanted to talk through some considerations and limitations to keep in mind that are relevant to our analysis. I'll just highlight a few. Firstly, we were very intentional about making all questions optional and allowing for multiple responses. But also, because we allowed multiple responses, you will sometimes see in our charts that the sum of the percentages exceeds 100%. That's because we were allowing folks to choose more than one response. And it's also worth noting that we did see in our sub-analyses, excuse me, that English speakers were more likely to select multiple responses compared to Spanish respondents. Another consideration is that we didn't require our respondents to have children of a certain age. So we didn't ask them to report the age of their children, and we didn't restrict that in terms of our participants. And finally, in terms of wording, we were trying to word our survey questions to be understandable through plain language, but it could be possibly because of that, or just because of lack of maybe public knowledge about childcare terms. We're conscious that there may have been different ways that folks interpreted survey questions, and I'll just give the example of family childcare that could be interpreted differently based on your understanding of the term. So one thing that we as a team do want to consider in the future, if we would do a similar effort, we might want to, for example, validate survey language so that we know that our questions are being understood and answered in a consistent way. But that is a limitation that we want to be aware of when we're looking at these results. And I'll bounce it back to Rachel to talk through our findings.
Great, thanks, Yisu. Okay, without further ado, we're going to share our findings, and we're not going to be coy about it. We're telling you right up front what they are. These are our 4 main takeaways that we're going to walk through today. I'll overview them right here, and then we're going to actually walk through the data for each one that led us to these conclusions. So one of the main takeaways we had, which we've heard before, and I'm sure you have too, is that the high cost of care is really impacting families' abilities to thrive, particularly because they are keeping parents out of the workforce. And therefore, unsurprisingly, families are wanting support from the city and helping make childcare more affordable. That support varies a little bit by population, by geography, so we'll dig into that a little bit, but on the whole, they are really asking for more affordability in addition to some other support. And then these second 2 findings here gave us a little bit of hope, given that the cost of care was really such a highlight. The other 2 gave us a little bit of hope of some immediate levers that we might be able to pull to provide some, to relieve a little bit of that cost burden on families. And that had to do with families' source of information and their access to information on subsidies. So first, we saw that not many families are getting their childcare information from resource and referral agencies, but those that are more likely to use subsidies. So there's a connection there, as well as we saw that subsidies were being underused in family, friend, and neighbor settings. And so these are 2 areas we'll talk about a little bit more that we think we could raise awareness around to potentially get more families access to subsidies, to childcare subsidies. So let's go ahead and dig into this first one. You're seeing here that almost half of respondents, 44% of families, are concerned that the cost of care is going to make it hard to pay for basic expenses. And we see that this is true really across populations, across language populations, and even here, based on the way people are paying, still true. So even the blue bar is demonstrating those who said that the cost of care was going to be hard to pay expenses who are self-pay, and the orange care for those that are using subsidies. So across the board, this is still really a big concern for families. And so we dug in a little bit more to this 44% who have this concern. And we found that a third of these families needed to make changes to their job, either reduce hours or leave their jobs in order to accommodate their childcare needs. Now, this number is notably higher than some of the national data. There's a recent national study that was done that showed about 15% of families were needing to reduce hours or leave their jobs. And this also likely doesn't take into account families or parents that were fired due to inconsistent care, which national data suggests is as high as 1 in 4 or 25%. So we think this could even be an underrepresentation of those whose jobs have been impacted due to inconsistent childcare or a lack of childcare. And more than 60% of the families, 63% of those who had to adjust their hours or leave their job are now caring for their children at home, which is more than 20% higher than the general population. And so what we're taking away from this is that families are needing to leave their jobs in order to care for their children at home. And by they're being kept out of this workforce, either because the costs are unavailable, sorry, the options are unavailable, they're too costly, or they're inconsistent and having too much of an impact on their jobs. And so, unsurprisingly, then, given this information, families are requesting the most support in lowering the cost of care. More than half of respondents are asking the city's help to lower the cost of care. Finding funds was kind of another way of saying that. That's pretty high as well. And you'll really see that across the board. There's a lot of needs. Definitely lowering costs is the highest, but there is still a lot of needs across the board. And one thing we did want to point out that was a little bit surprising for us was that finding care was the lowest. We're still seeing, about a quarter of respondents are saying that they want that support from the city. But anecdotally, we've heard that this is a real challenge for families. And so, this is something that we want to dig into further, but also are surmising that potentially based on all of these priorities, if there are so many barriers to accessing to care in the areas, not enough care in the areas, and the inability to pay for any formal care, that finding care just might not be that the most priority, the highest priority on families' minds. When we dig into this a little bit more by demographics, so the data gets a little bit more complicated, a little bit more nuanced. So here we're looking at the response to this question about what support the city can provide based on language. So on the left here, we're seeing English respondents, and on the right here, we're seeing Spanish respondents. On the English respondent side, we're seeing a pretty similar picture to the overall. They are prioritizing lowering costs. They're asking for support in lowering costs. And we're still seeing some relatively high numbers in some of these other areas, but there is a clear priority for this group. Whereas when we look at Spanish respondents, we're seeing a bit of a different picture here. Actually, lowering cost is not the priority. Here, the priorities are really creating more options and improving quality. And the other thing I want to note is that there's definitely a priority here, but it's not nearly as drastic as we're seeing in some of these other communities. And so there's really sort of a broader need for support among the Spanish-speaking population. And when you look at those, the childcare um, desert status, you're seeing kind of a similar picture. So here again, we're looking at childcare deserts versus not, those who are living in them. So we have on the left side those who are not living in childcare deserts, who have more care options near where they live. And on the right here, we're seeing respondents who are living in those childcare deserts. And so again, this is almost, I'll flip back for a moment, but you'll see if you look at the chart here on the left, it's almost exactly the same. So we're seeing that those who are not living in childcare deserts, again, are prioritizing the need for lowering costs, and that's notably higher than some of these other requests. Whereas when we look at those who are living in childcare deserts, again, we see sort of the same level, an equal request, more than lowering costs, to create more options, to find funds for supporting, and to improve quality. And so really what this is making us think, and we know there's some overlap, as Hisu was sharing before, between Spanish speakers and those who are living in childcare deserts. Based on our respondents, those who are living in childcare deserts are more likely to be Spanish speaking. And so we do note some of that overlap there, but it also suggests that for those Spanish families and those who are living in childcare deserts, that they might be facing greater barriers to accessing formal care, which is why they're asking for more help in the basics of creating more care and ensuring there is quality alongside meeting the cost needs. And so we dug into that, thinking a little bit more, and we found some additional evidence that suggests this. We're looking here in these about, again, we're comparing those who are living in childcare deserts, those are in the orange, versus those who are not living in childcare deserts in the green, and that blue is a general sample just to ground us. But what we're seeing here is that those who are living in deserts are more likely to be getting free care, to not be paying for care at all, than those who are not living in deserts. And they're more likely to be caring for their children at home. So again, we're finding evidence here that some of these families are not entering the formal care system. They are caring for their children at home for free. Um, and we're surmising, based on the feedback that we're getting, that there are a number of reasons this could be the case. The options are not existing, they're not high enough quality for families, or they are too costly. And so already this piece of information is helping us shape how we're going to focus our efforts based on community and geography. But before we get there, we wanted to share two additional findings that really continue to clarify the work for us, but also provide potentially some immediate changes that could reduce that cost burden for families. So the first one is around where families are getting their information. And we're seeing here across the board, about 60%, a vast majority, are getting their information from personal networks. Um, and we do see, other options included the internet or schools, resource and referral agencies, community-based organizations. And we're seeing that when you split this down by language, that there's a bit of a different picture here. Both for Spanish and English speakers, personal networks are still the most. When we look at the English language population, though, those who are in orange here, we're seeing a vast majority are getting their information from personal networks, and secondarily, they're getting their information from the internet. Whereas when we look at the Spanish speaking population, again, the majority are getting those from personal networks. But schools are a close second in terms of where they're getting their information. And so that difference is really important for us when we think about how we're communicating information to families. What we found really interesting about this is that when you look at the information by payment type, how they're paying for care, those who are receiving subsidies are most likely to be getting their information from resource and referral agencies. Now, and community-based organizations, that number is jumping up as well. And we know there's a little bit of a chicken and egg here. We know that a lot of our resource and referral agencies, in fact, all of the ones that serve LA City, are also the alternate payment programs, which means that they are the ones who are often providing the subsidies for families. And so it could be that those who are using subsidies therefore have more interactions with resource and referral agencies, but it also could be the other way around. Whereas those who are getting their information are more likely to also get information about subsidies and to be able to access them. And so when we look at, again, we've added in now the free category, those who are using free care, we can see that not many are getting their information from resource and referral agencies. And we're wondering whether, if we increased the access to the information and increase their use of resource and referral agencies, whether some of those families would be able to access formal care because they would have more information and access to those subsidies. But we also know that not all families are interested in the licensed care and the formal care network, and many of them, and we see that family, friends, and neighbors account for a lot of the care that's being provided in the city, and many families are preferring that care over centers or family child care homes. And so we also wanted to take a look at what's happening there in terms of payment, and so we saw that for those families who are using family, friends, and neighbor care, there is a much lower percentage than of the average group who are using subsidies, which means they are being underutilized for those who are with family, friends, and neighbors. And this is both impacting the families with children in terms of their costs, but it's also influencing our family, friends, and neighbors who are providing the care. Many of them, as we can see here, are not getting paid for their support, which means that they also are being impacted by the high cost of care. And so what we're seeing here is that even for families who would like to use license exempt care, that there is potentially an opportunity to increase awareness and access to subsidies that could lower the cost burden. And so we're back here. These are the four main takeaways we wanted to share with you today. And what we want to do now is walk through how some of this data has started to influence our work and how we're thinking about our work. So the Child Care Policy and Equity team identified four areas of focus within the first 8 months of our work, both through conversations with those who are already in this space, through research, and then also, importantly, through conversations and focus groups with providers. This link down here is a report that came out of those conversations and provided us a lot of really important insights that have already dictated the work we're doing. And so we wanted one big question we had when it came to this survey was, are these the right areas? Is there anything that we're missing to make sure that when we focus our work, that we're also meeting the needs of families? And what we found, as is pretty obvious from our finding, is that these are indeed the areas that families also need support in. The cost is exceedingly high and it's impacting their well-being. Particularly for Spanish-speaking populations and those living in childcare deserts, the need for additional options for greater capacity is evident. And then lastly, especially from our final two findings, this idea of potentially using communication, increasing awareness around subsidy use, both for licensed and license exempt care, might reduce those cost burdens. The sustainability piece is really focused on childcare providers and making sure that they are running, effective and strong businesses to ensure that they stay open and that they stay sustainable for their own well-being as well. And so what we found though is that of course, the well-being of providers, it's influencing the options and the quality of the programs for families. So even though the sustainability is really more focused on providers, we know how intimately their well-being is connected to that of families and their ability to stay open and provide that capacity and to manage costs for families. And so we wanted to provide a little bit of insight into how this data has shaped some of the work we're already doing, but also is starting to shape the work that we're looking at in the future. So we have a sample list here of some of the initiatives that our team is working on. I'm not going to walk through all of them. It's also not the extent of what we're working on. We have a lot of irons in the fire that we are excited about. But I do want to walk through a couple that speak directly to the data we found here and are changing our thinking about it. So the first one is that the city of Los Angeles was awarded a capacity building grant from the National League of Cities, and the mayor's office is leading this work. And then the intention of the grant is to um, bring together a diverse cohort of stakeholders in this space and to create a comprehensive approach to strengthening the system for both families and providers. And our team is working really closely with the mayor's office as an active member of that team of diverse stakeholders and bringing them the information that we have, including from our conversations with providers and now this information from families. We also heard from providers that opening and expanding programs was really challenging, especially to navigate in a city like LA, which has a lot of different departments and regulations that dictate that work. And so we have gotten together an interdepartmental group. We have 6 departments within the city that we're working with, in addition to the Community Care Licensing Division of the state, who has helped us walk through the A to Z of opening a childcare program or expanding a childcare program. And we're really excited. We're finalizing that toolkit. We are hoping to release it this summer. And then we're also looking for funding to support those startup costs, which can also be a barrier to providers in order to address some of that capacity needs that we're seeing. In the meantime, we're doing a lot of our own data mapping in order to better identify those areas where families are telling us that they need more care options. And then we're investigating ways for the city to support providers and organizations to increase care in those areas. Um, and then the last thing I'll speak about is I mentioned before that we've launched a website. We want it to be the central information and centralized hub of information, and we are continuously updating and building that out. But the other thing that we are doing, particularly based on the information we have here, is designing education campaigns that where we can elevate and build awareness, particularly around resource and referral agencies and the work that they can do to support families, particularly around those subsidies. And we're looking to partner with community-based organizations, with schools, because we know that's where a lot of families are getting their information, in addition to the internet. So we want to be proactive about the information we're putting there, because what we're seeing is that just putting information on a website is not going to get to all the families, and particularly the ones that we see have greater need. And so um, we are really diving into a lot of this work and really excited about it. And hopefully, we'll be reaching out to many of you on this call to partner because we think that's really the best way forward.